Thank you for joining us during your lunch hour. We know your time is valuable and we know that you have other things you could do. So thank you for joining us. We're going to do a couple updates today. We're going to talk about COVID and about CIH and the updates that we have, the services that we have that we're starting to provide again. We're going to focus today on mental health and how, this has been a real challenge for all of us. This has been both a physical trauma and also a mental health challenge and emotional trauma. So we want to really understand how we can collectively come together as a community to transform this and make the best of it as we can and work together so we can get through this together. So that'll be a big focus today. We have a lot of resources, a lot of people I'm excited to talk to and also hear from you. We want to really make this very interactive today. Jen, could you sort of tell people how, and thank you for putting this presentation together, Jen. Also, this is great, awesome. How do you raise your hand? That would be one, just to walk people through that in case they don't know how to do that.
Yeah. So someone is raising their hand now. So you should be
Someone
able
already
to.
knows.
You should be able to raise your hand. I'm actually not sure on the attendee side what it looks like, but I think if you press the three buttons on the bottom panel of the Zoom window, there should be an option to raise your hand. So if you want
Yeah.
to use your audio to talk to us at the end, you can. Or you can always chat in the chat box too.
Can someone, maybe one of the CIH staff, try to raise their hand now just to see if it works, to make sure that Evelyn, okay, thank you. All right, so got a lot of people. All right, so it looks like it does work. Please raise your hand at the end more, but if you're having a question in the middle that you really want to raise your hand, we can do that too. So we'll have that. So we want to talk about updates first. First thing I want to do is actually ring the Tibetan bowl that I have here. So I don't know if some of you are my patients and we sometimes do this for meditation here. And I want to really honor some of a lot of the people that have been infected by COVID, the healthcare workers that are on the front lines, but also the teachers, the students, the families, the moms, the dads, and then the people that have been lost from COVID. So I'd like to just take about 30 seconds here to ring the bowl and just, if you could just close your eyes and say a little bit of a thought or prayer, for them and the families that have been affected, and for all of us here. So just may peace be with everyone that's been affected by COVID, either directly or indirectly. We're going to talk about this a little bit more later today. Thank you. So the CDC has recommended that 6 new symptoms be added to the known COVID symptoms of fever, coughing, and shortness of breath. Those are the top 3 that are typically known. They also recommended that chills, repeated shaking with chills, muscle pain, headache, and sore throat, as well as other ones which are not on here, but loss of smell is another one that I think could be a symptom that we've seen, as well as from people on telehealth, as well as dizziness as well, and potentially diarrhea because it affects the gut as well. Dr. Hogan, I think, is doing a great job from what he can do to bring Maryland back from this. I say Maryland because we're in Maryland, but I think the DC region in general, this is a great roadmap to recovery. There are 4 things that are needed as building blocks for recovery. One is personal protective equipment that is still needed. He has gotten some from his wife's home country in South Korea that's helping us. I want to shout out to South Korea for that. But PPE is still needed. We've also gotten some testing capabilities, some basically free tests from South Korea as well, and he's working with national and local labs on that as well. The storage capacity is pretty good. There's 6,000 bids that have been added, so there's not any anticipation that we're going to be like New York City where we're going to run out of bids, so that's good. And then he's also hired through the different health departments 1,000 contact tracers to help figure out who might have been exposed to someone with COVID if they do get COVID. The three leading models of COVID spread and rise, et cetera, which are the Institute for Health Metrics and Evaluation at the University of Washington, the COVID-19 Hospital Impact Model for Epidemics at UPenn, as well as the Johns Hopkins Emergency Medicine Group, all indicate that Maryland is successfully flattening the curve due to social distancing and treatment. So the surge is avoided, but because of that, the peak has yet to arrive. So the cases are still going up, they're just going up in a more gradual way. And according to Governor Hogan, reopenings would depend on the trajectory of COVID-19 and be classified by low, medium, or high risk categories of activities and be separated in terms of when things are reopened by 2 to 3 weeks. So there's two little links here that you can do at the bottom here to find out more about both Governor Hogan's plan as well as coronavirus updates. I checked this morning and there's 985 deaths in Maryland and 218 deaths in Montgomery County. The research update real quick before we go to the mental health piece, which is our focus today, is that an NIH clinical trial has shown in the last week that preliminary data from 68 sites all around the world of over 1,000 patients indicate that patients who received remdesivir, which is a drug that's used more for HIV and to inhibit viral replication, had a 31% faster time to recovery. Hospitalization decreased from 15 to 11 days versus placebo in patients that were treated with remdesivir. This is an NIH clinical trial that's still ongoing, and this is the first major positive trial of any drug that has been shown to be, truly helpful. So the mortality rate also went down from 11.6 to 8.0%. And that trial is ongoing. There's also one leader that seems to be emerging from the vaccine progress. Dozens of companies are working on this now, but Oxford University takes the coronavirus genetic material and injects it into a relatively harmless common cold virus that has been neutralized so it can't spread in people. So they've already tested a few people, and they're actually going to test a human clinical trial in May of over 6,000 people to test safety and effectiveness, which will bring it up to the level of a phase 3 clinical trial, which is very fast. Anyone that knows anything about vaccines, that's a very fast result. So people are actually expecting, or hopeful rather, that this vaccine, if proven safe and effective, will actually be available by this fall, which would be amazing. And I think we always have to evaluate, safety and cost and benefits. We are going to be working this summer on a pre and post vaccine nutrient protocol to help our patients with getting through vaccines safely if people have concern about that. And then at CIH, we now have this starting this week here. This is the first week we've been doing this. LabCorp came out this week with blood antibody testing, serology antibody testing. Televisits with Paula Marchetti, who's one of our physician assistants, are required. The first visit is to review their general health and symptoms, if any, and then order the testing. The second is to review test results, because we don't want to have people tested blindly without really understanding the implications of testing and the results and what to do with that. All these visits and the lab core testing is billed to insurance, and there is a 2 to 3 day turnaround with that. There's also a test that I just got in the mail just a couple of days ago right here. This is a Ray Biotech point of care testing that takes about 10 minutes to do in the office with one of our medical assistants, and we would know the result within 10 minutes of us doing that. That would also be billed to insurance. It also requires visits to our physician assistant, Paula Marchetti, and that will be it says 2 to 3 day turnaround, but it's a 10-minute turnaround on that. So we will have that ready fairly shortly. I expect to announce more about that next week. Here's just some fun pictures of people in the office today or recently. We have Martasha here, our LabCorp tech. Christine is our patient model here, practice administrator, Christine Gordon, and then Ashanti and Trisette are here and waiting to see patients, and they have their PPE on and they're very safe. doing that. This was me before we opened last Friday, getting an IV from our IV nurse, Laura, and got an IV Immunoboost, felt great. Continue to keep nutrient levels up here. And then this is my new family bunny, or our family's new bunny, Dandelion. Dandelion is a lion head rabbit, so that's why we named him Dandelion. Our son actually named him because of the lion aspect. Kind of looks like a pretty gentle lion, I think. You can see the resemblance there. She's vegetarian also. So the first polling question is how much would you like us to cover COVID-19? Because we have a lot of information coming out every week. We don't necessarily want to inundate you with it if you're already kind of looking at it on Google and TV news and things, and we know that your time is valuable with this, and we have a lot of things we could cover. So I just want to, we really just here at CIH want to be of best service to you and as best way as possible. So I think the choices are as much as possible, continue providing updates on testing and research, give the most important updates only, or as little as possible. I don't want anything to do with learning about COVID-19 because I already get it from enough sources. And Jen, you're going to stop the poll, right? I don't have to do anything with that?
Yes.
Got it. Okay, thank you.
Okay, so here are the results.
And then do I announce them, or can people see them already?
You should be able to see them, but you can announce them as well.
Yeah, most people kind of want a mix of a little bit on it, providing updates on testing and research. Interestingly, 0% said as little as possible, so I'm glad that some of this is of use to you. We will continue trying to prioritize what we do to make this a more balanced session, which is both information, sharing as well as community building as well. Thank you for that. And then how soon would you, so we're trying to figure out how, safe it is for people to come in, and we're going to certainly listen to Governor Hogan on that. And we want to really also see your thoughts on that, because this is a patient-centered practice and a patient-driven process, along with kind of on the healthcare side. We want to be as safe and do all the things to do so that you can be safe and feel safe here. So how soon would you be comfortable in coming to CIH for things like in-person visits, like physicals, blood work, etc. Now, blood work is already available, just an FYI, and IVs are already available, but other in-person visits would be a question for you here. So it looks like the choices are now. You come in now, May, June, and we're not doing physicals yet, so that's one of the questions that we have. May, June, July, or later, or it depends what happens in the next few weeks. All those are pretty interesting choices there.
We'll give it another second. There's
okay.
84% have voted.
High number. Hopefully that many people vote in the general election. That is what I'm hoping. Always good to have participation.
Okay, here are the results.
Depends on what happens. I think I totally agree with that. Depends on what happens. We are really evaluating this week by week, and we're gonna make the best decision for our patients for this. So thank you. And this is another real patient experience question. As I think for those of you who had, I guess it looks like there's a question of if you hadn't had a telehealth appointment yet, but how has your experience been on telehealth using Charm, which is our EHR here? Have you been enjoying it? It's been pretty good. It could improve. There's technical issues. Certainly that could be an issue. It looks like prefer in-person visits would be sort of like, I don't really like it. I want in-person visits. So some of these are I think you can choose only one of these, or haven't had a telehealth appointment yet, so not applicable one. I've enjoyed it to a degree. I mean, I do miss seeing people in person. I think there's an energy there that is sometimes harder to do over the over the internet, but we do know that energy is non-local, and that there are actually studies showing that energy gets transmitted non-locally. So interestingly, only 51 only 42% haven't had a telehealth appointment yet. So if you haven't, I definitely encourage you to connect with your practitioner or their staff, and kind of get on there, because I think one of the things we want to emphasize is that health doesn't stop. It doesn't go into this vacuum in outer space and get sucked up. Your health is really your biggest wealth and your biggest priority right now, of course, with COVID, but it's also your biggest health kind of long term. So we don't want to lose sight of the fact that we need to promote your health and wellness, and to prevent things. That's a way to kind of connect. So please connect with your practitioners, whether that's your medical practitioners, nutritionists, acupuncturists, psychologists, physical therapists, massage therapists, whoever you see, whether they're at CIH or outside of CIH, please check in with people that you work with on a regular basis. The people that have been on telehealth, that's really happy to report. I'm happy to report that 51% of basically most people, 90%, I think, of people that have been on there are enjoying it. So thank you for that. And then Jen has created, which is amazing here, we're creating this CIH Tribe Facebook group. So it's a place for you to go, and you can join now if you'd like. You can join later. The link is right there. You can just click on the link to join. This is a place for us to build community, for you to connect to your CIH community. It's not only open to CIH patients, it's open to people that are interested in what we're doing, interested in health and wellness, interested in moving the needle on prevention and on holistic health. And it's a place to get access to additional content that you might not get from your appointments. You might not have time. You might be on the website, but there might be additional things that we share here. I'll be on there. A lot of our practitioners will be on there. We want to share health tips together. We can be our own health advocates. We can actually do this together. So you can think of this as your tribe, and we can meet like-minded and health-oriented individuals, because we know that health doesn't happen in the vacuum, right? Health doesn't happen on an island unless you're in Hawaii, then it does happen on an island. But other than that, that's going to be our way to connect with each other right now and moving forward. So the meat of the presentation here. So this is going to be more of an interactive discussion, hopefully, and I'd like for a lot of you to raise your hands and really a community contribution here. But we'll start with a few resources that we have from our healers and practitioners of mental health and wellness resources. So first of all, we know that, we're stuck at home. We're all stuck, maybe we have families, maybe we have kids, or maybe we're alone, or we have a pet or something. But, we're all kind of in this isolation mode, right? We're kind of isolated, like this hot air balloon up in the sky. Or is that really the case? Are we really still connected? How can we still be connected? How can we transform this, both physical and emotional and spiritual trauma of COVID-19, basically transforming the whole world? How can we basically acknowledge this, first of all, acknowledge the gravity of this, the tragedy, the loss is bitter, bitterness here of this, as well as some of the opportunities that we have to move forward and learn from this, and to move forward this, with this together. So Dr. Dan Gilman, who's our psychologist at CIH, has put together a list of mental health resources. Thank you, Diane. She could be on the call today, but thank you for providing this. There is a support group led by therapists every Monday, Wednesday, Friday, 9 to 10 at the Counseling Center of Maryland. So there's a link there. There's also a sanity guide from 10% Happier, and some free mental health apps that she has kind of put in there. Some journaling reminders, meditation. Headspace is great. Relaxation techniques. And then it looks like there's also a free 6-month subscription for healthcare workers. If you put in healthcare access to this 10% Happier meditation app, then you basically get a free 6-month subscription. So please take advantage of that. And it looks like Headspace is also said for the 2020 calendar year that there's free access. So that's great. So thank you for all that, Diane. Liz is on the call too. So Liz is co-founder of CIH here, acupuncturist extraordinaire and healer extraordinaire. So love to have your thoughts, Liz, on acupuncture, and also your thoughts about right now during the COVID-19 crisis and how we move through this.
Yeah, hi everybody. Thanks so much for coming in and joining the call and doing good things for your own health. I think, from an acupuncture perspective, I've been looking at a lot of seminars and listening to the Chinese medical perspective on this. But when we're talking about mental health, and spiritual health, really, there's not herbs or acupuncture points at this moment with you all, virtually, that are going to make everything feel better. So a lot of it has to do with aligning ourselves to what is happening right now. So it's more like a conversation that at some point maybe we can open up to people. But I don't know if any of you are feeling this. I certainly am. And with my patients who I'm talking to and friends, this sort of going in and out of a sense of reality of like, is this real? Is this not real? Is this real? Is this not real? And so you get this kind of stop start kind of sensation, but underneath what's happening is this real deep sense of uncertainty. And so some of us are finding that we actually feel like, yeah, this is okay. I'm doing okay on this whole thing. And other people are in a lot of fear, but underneath most people, there seems to be this deep uncertainty that's affecting body systems, mental, emotional health, things like that, like old stories coming up, old mental stories, old symptoms coming up, showing up that haven't been there for a long time. So mentally, what I've been kind of working on for myself, because I'm in the same boat as all of you, is to take time to really, for lack of a better word, really is like honor what's happening right now. We're shut in, right? And so we've been in this expansive state for such a long time where we're doing more, wanting more, buying more, learning more. Just it's been very expansive. And now this disease is having us go internally. So we can also notice that at the same time, this sort of like expansiveness is coming into our homes also, where there's less boundaries on like, okay, I have a Zoom call here and a Zoom call there and all this kind of stuff. So we're finding that there's also this churn even in our internal world and our household. So finding time to actually to let yourself be quiet and to be in the energy of this moment, which is more, it's more contracting than expanding. I don't know if that's any helpful, but that's just from an energetic point of view and how we look at it from acupuncture and Chinese medicine, Taoist point of view. I see some questions coming up. Okay, none for us. There's also things that you can do. Corey is not seeing patients right now, but I'm seeing a couple of patients in the office, and for people who are having surges of old symptoms, whether it's like mental health symptoms or even physical health symptoms, I'm definitely willing to see people. So, but it's on a limited basis.
Thank you, Liz. I'm wondering in terms of, I'm going to get to Corey's in a minute, but there's this other slide that I wanted to. Mm-hmm. Is there any role for looking at the elements right now in terms of like the 5 elements and how that interplays with it's more uncertainty, so would that be more kind of working on certain areas?
Yeah, I think again it's like I was listening to a podcast, a Chinese medical podcast, and they were talking a lot about the cytokine storm that we've been talking about, like this inflammation response, which a lot of our patients have been dealing with for a long time. They have like inflammation disorders, and knowing that also goes back to the gut permeability as being one of these like primary factors in that. Even beyond that, we go into the fact that a lot of our gut is messed up because we are pushing ourselves mentally very hard most of the time. We're engaged all the time, and that actually goes, Andy, the earth, the spleen, stomach, digestive processes, because we're so externalized right now in terms of being on Facebook, being on Instagram, Zooming with people, organizing the kids' school, everything. We're trying to process, our brains are trying to process so much, and it creates this underlying stress response, especially with like the polyvagal network.
Yeah.
And that not only that slows down our digestive, our ability to absorb, which then decreases our ability to have proper immune response. So, you know, we need to be tending to our thoughts a lot. We need to be tending to our thoughts and have limits on how much we're trying to absorb, you know, even mentally.
And 60,000 thoughts a day. I mean, we basically think 60,000 thoughts a day, and those thoughts can either generate a cell safety response or a cell danger response. Right? There's this idea of in health about a cell danger response and how there's different reactions that the organism will have to an environment, you know, based on if there's too much on the plate, you know, the vagus nerve is suppressed, and then the cell danger response kind of starts taking over, and those inflammatory cytokines start taking over. So it's really important to tend to the garden, so to speak, you know, to tend to your body, mind, spirit, and you know, do that in a preventative way, so that you have your body feels safe, you know, because right now this is a time of drastic change, time of extreme stress, you know, overall, and so you want to make sure that your cells are and that you're basically feeling secure. So you know, in terms of whatever you can control, which is, you know, not everything, of course, but you know, there's certain maybe habits or, you know, certain things that you can do on a consistent basis.
I was just looking, Andy, at the one of the questions, and I think it's Leslie who asks about explaining water, metal, wood, earth, and fire. So I think really like the most basic way to look at it is that, you know, from a Taoist and Chinese medical perspective, you know, we're made up of many different energetic movements. And those energetic movements, our being is a natural being. We're made of this earth. We follow the same cycles, and what we can see as expressions of energy and movement, natural movements in the external world. So like just, you know, like the seasons is a great one, is happening within our body. That same energy is happening. And ideally, you know, health comes from being very balanced within all of these different types of energies. We predominantly, as like modern American people, tend to have a disruption in a couple of key elements, for lack of, when a lot of times it's the earth element, which is like the stomach and spleen, which is about digestion and absorption of all things, thoughts, energy, food, breath, and the wood energy, which is the liver, gallbladder, which is sort of like springtime energy. That energy wants to come up and out, and we're always like hard charging people, but a lot of times it that up and out energy gets sort of stagnated, especially when the earth energy is not well balanced, and it creates disruption, especially in the digestive system and our detox systems.
Angela did ask also, thanks Liz, she asked, can you overstimulate your immune system? She's taking Chinese herbs and vitamins, and is there such thing as too much? And then also Michelle asked about how to tend to your thoughts, and she was talking about gut disruption. It sounds like both of those are more of an overstimulation type of picture, which you were just talking about there.
Yeah, I was going to say one really interesting perspective about COVID is that, you know, in Western medicine, oftentimes we're treating the virus, right? We're treating the pathogen. In Chinese medicine, we can do that, but it's more about like, how do we create a better, as we talk about in functional medicine, functionality, right? So there are different things that you do at different stages of this disease. So in the beginning stages, we want to stimulate, well, preventatively, we want to be stimulating our immune system. So you want the vitamin C, the vitamin D, the elderberry, all that kind of stuff is really good. It's helping create that natural defense. We want to be tending to our guts so that we're not having inflammation happening underneath the surface. But if the pathogen gets in our system and we start feeling not as good, then we want to sort of adapt our techniques. So at that point, we want to increase our defensive qi, which pushes out the pathogen. So with that, you can do things like sweating. There's certain herbs that you would want to take for that. And if you're working with an herbalist, that herbalist would know that's going to be usually like your Wei Qi defense herbs that are usually prescribed for cold and flu at the onset. So you can keep taking those, but you may want to, if it progresses even farther, you may want to stop on that, because we've been, there's been talk about this cytokine inflammation storm, which can cause more problems as the disease progresses. So you'd want to change tactics at that point and maybe not be overstimulating your immune system, but kind of like trying to calm and create a proper flow of energy through your body by actually doing breath work would be a really good thing.
Yes, and we have some slides on breath work in a bit, so this is great. Thank you so much, Liz. Corey had some comments. Corey is acupuncturist here too, and Corey was saying that what mentally imagined future are you writing for yourself these days? So he was saying to be careful when you're designing a disastrous outcome for your life in your mind, because your mind will want to create it. So deciding on the actions that will protect you from what it dreamed of as a worst case, but rather looking to the future and visualizing what you wish to create and unfold backwards with things like in 5 stories, the story I will tell myself is that, etc. So even though we had an unfortunate situation, I stepped up and became a great husband and spent some time with my family, took some actions that took me to in a situation that made the best of things. And so I think this could be an invitation, if I'm interpreting this right, is to take a new look at your life's priorities, kind of take a 30,000-foot view of some of these lifestyle decisions, and you can pivot a bit and make some adjustments in order to kind of visualize your success in the future for your health, whether it's health, whether it's family, whether it's finances, whether it's something that is going to nourish your soul so that you become more who you would like to be in the future. Thank you, Corey, for that. Thank you, Liz. It's great. And then we're going to go to advice from Carrie. Carrie is our licensed massage therapist that does myofascial release. If people haven't done this before, it's a really game-changing, really life-changing treatment. And we know that the fascia stores a lot of emotions. The fascia is the soft tissue that connects all of the organs throughout the body, has its own energy. And thank you, Carrie, for this advice here. There's a picture of her right there. Taking time to be aware of feelings, thoughts, and emotions that are coming up. So really using the awareness, really taking some time to just slow down and pause, and to, as Liz said, kind of, slow down and not do so much at one time. I always kind of say also it's this syndrome of TMOP, which is too much on your plate, right? Whether it's too much thoughts floating around or too much stuff you have to do, really just to simplify a little bit as much as possible. Even if you can't take everything off your plate, let's pause to be with these feelings, thoughts, and emotions, and just breathe through them, not taking them away or suppressing them, but breathing through them to help process them. So what Carrie said, which I'd like everyone to do now too, is to just place your hand on your chest in the heart chakra area, which is a couple of, I would say a couple inches above your breastbone. So you can put 1 or 2 hands here, and just feel that. You can close your eyes if it makes you focus more. And we could share if you want in a bit later, just to feel what emotions come up, and not to push them away, but just to kind of breathe through that right now. Take a couple breaths here. Giving yourself some love and compassion right now for this trying time that we're going through. Hopefully you felt the warmth of your hand there. Now so there's more on myofascial release. Carrie has a website, myofascialreleasedmb.com, which you can find out more about her and her work, which is very, very deep, and I highly recommend that, as well as acupuncture. Reiki as well, another powerful practice, and Dana Keys is our Reiki practitioner here, and she's great. I've had treatment with her myself. She really also has great energy, and can help you move that energy, help you move your own energy. in a bit in a more balanced way. And so Reiki, if people haven't done that or know about that before, is a safe, non-invasive energy practice that promotes relaxation and healing, and it can support well-being and complement traditional healthcare. And I will say a little word about complementary healthcare. My personal belief is that healthcare should be more broad than what it is. And so I think that when we say complement, I would almost say it's almost like, and sorry, Dana, if I'm modifying this a little bit, but I would almost say it synergizes. I think taking the best of all worlds, is what we really need in healthcare to move forward. And I think we are, working on that here at CIH. So thank you, Dana, for that. And direct Reiki, so I guess there's basically Reiki without touch, and there's Reiki with touch, direct Reiki. And it involves lightly laying on of hands just above or above the clothed body. So you leave your clothes on in this practice of Reiki. You work over the front and back in a slow progression of hand positions. And then there's distant Reiki, in which you don't have to be physically present with the practitioner to receive the energy. I've also had distant Reiki with another practitioner in my previous practice, and I think both of them are very effective. And her website is aurabalance.net, so please find out more about Dana there. Thanks, Dana. Elizabeth Reese also did a webinar for us, with us recently, and that was well attended and really great. And heart math is an amazing technique, a biofeedback technique that is based off of research also that allows you to tap into the heart-mind connection to bring your stress levels down in a measurable way. There is an app called Inner Balance, which you can purchase from the Heart Math Institute, and you can plug it into your iPhone, clip it to your ear, and you can basically measure your state of coherence over time as you do some meditation or breathing, and you can put your heart and brain into more coherence with each other, and it's a great way to self-regulate your system, to kind of keep the system balanced, to keep the energy channels, to keep the chi flowing in your system. And so our heart rhythm patterns reflect the inner state of our body, mind, and spirit. So working with them can help to reduce anxiety, manage depression, lower fatigue. It also helps sleep, a sense of calm, and boost the ability to focus, as well as many other benefits. Her site there is interflourish.com. It's giving you some resources here. Thanks, Elizabeth, or Liz, also here for that great contribution. And then Bev is a friend of ours that is in Germantown, and she does do distance EFT or emotional freedom technique. She'll also, I think, go out to your house and do some EFT as well. She's also trained has trained the Cleveland Clinic and American Nurses Association and Kaiser staff, so she's done a lot with organizations as well. And like emotional freedom technique tapping which both Liz and I have had personal experience with, and really game-changing experience as well, in terms of our own lives. Or I speak for myself too, and I think Liz could speak for that too. Is a scientifically proven energy healing technique based on both modern psychology and also 5,000 years of acupuncture. Doesn't use needles, does use your own energy and your ability to basically quote unquote tap into that energy using your own thoughts and using some physical movements of actually tapping physically on your body. So it has the ability, like many techniques, to take the nervous system from being in the stress response to the relaxation response, where our body works optimally well and where we may feel relief from negative emotions and pains easily, effectively, and quickly. It's very easy to learn. Children can learn it too. There's actually books on, for children on that as well. And Bev is a certified EFT tapping practitioner, and her email and phone number are there. So thanks, Bev, for that. I know you're on the call today too, so thank you. Liz, yes.
I was going to say, what Bev does is a really fabulous way to work and tend to all the elements, all the different energies that our body contains that keep us healthy. So I definitely recommend reaching out to her to learn the techniques.
Thanks, Liz. Yes, I second that too. With Bev is an expert at this, and she's been doing it for a long time, and I think that she has helped a lot of people kind of guide them through that journey of tapping. This is something that Elizabeth Reese shared on her Facebook, so I wanted to share that because it was so, especially this at the bottom where it says we may not be able to go outside, although but we can go inside. So even if we're stuck at home and we're isolated and things, this is a time that we can go inside and we can work on acceptance, we can work on realization of what's kind of going on, and then cultivate compassion for ourselves and others. Go through a routine. I think it's what, as Michelle was kind of commenting earlier about her gut, go through a routine to help ground that uncertainty. There's certain things that we can do every day, like take a shower every day, or we could, do our meditation every day or something, do yoga every day, connect with your friends or family every day on a call. Do something where you're having a routine that's going to set your body up, set your energetic pathways up for a sense of safety and a sense of this, habit, so that you're sending a message to your system to say, hey, things are chaotic, things are kind of falling out of the sky, but there's some routine here that I have some control over. Creating pockets of healthy routine is what it says here. And then letting go of what you can't control, which is a lot of things. Like, we really can't control a lot of things, but what can we have as a routine? And then connection, emotional connection doesn't have to mean that you're, having beers with everyone or something like that. It's more like, let's still emotionally connect, and we can do that non-locally as well. Courage to stay open to tough options, as well as, reset and wisdom. So I just want you to, look at this later, and I think we can, I'm going to look at this later because I need to look at it more, but I think there's a lot of wisdom in this, and I like this too. Life's beauty is inseparable from its fragility. So thank you, Liz, for that. Physical therapy, I did ask Dr. Hiza to also comment, and thank you for this too, Hiza, because exercise and movement is also part of the medicine. We're meant to move. We're meant to move our bodies. So we talk about acupuncture and stuck chi and stuck energy, and that causes anxiety, depression, and cell danger response. We can actually move our bodies to move some of that energy, to move some of that energy that needs to go from top to bottom down. Any energy that needs to go from bottom to top up, potentially. So there's a way to circulate that energy through movement and through exercise. And as Dr. Hiza says, exercise is part of the medicine, and just like all the other medications, whether it's food, whether it's lifestyle, whether it's connection, energy medicine, the dosage makes all the difference. So he's recommending things like a walk in the neighborhood. Others might be a jog or bike ride, but it could be, depending on if you have arthritis or limitations, you just sit and stand from a chair. You do some climbing of your stairs if needed, so things like that. Anything that's going to make you more functional right now is going to be helpful. So thank you for that. And we want to know also, we want to make sure we have time for your comments too. How else can we support you during this time? So is it town hall sessions? Do you want more of these town hall sessions? Do you want to provide more webinars on certain topics? Immune health, gut health. We are going to have, which is another question we have coming up too, a group visit based on insurance for immune health, which is coming up. So we're going to ask about that. Do you want more daily updates on research and testing through social media? Do you want to hear, do you want other, there's probably some things that are not on this question. Do you want to hear from other medical wellness and nutrition practitioners? Are you tired of seeing my face all the time, which I think it's good to have rotate people through. And I think this is amazing. Thank you, Liz, for coming on too. This has been great. And I think we do want to hear from we want to hear from you, and want to hear from other practitioners too, and have a sense of building this community, because we all have something to support, whether you're a practitioner, whether you're a patient, whether you're a staff member here, whether you're any part of the CIH community. We all have to work together on this, and we all have something to contribute. So I'd love to see your response to this, of how we can continue to be of best service to you. Multiple choice, yes. So it can really be any of those things. Hopefully we're getting some chats here too. Let's see. I can go to chat 17. Okay. Ooh, live group meditation. That's a great idea. Continue town hall sessions. Thank you for that. 92% want to continue it. I appreciate it. You can always watch the recording later, or I think I get tired of them too sometimes myself. I love doing these, but it's more just like, I just wonder if people are interested in them, which people are, it seems like. But I think when I say tired of them, I just mean I want to make sure that we're providing fresh content for you and stuff. So if you're tired of like coming on at lunchtime or whatnot, or you have something to do, or your kids are banging on your arm or something, which can happen, then just watch it afterwards, even if you have time. Provide more webinars. A lot of people want to do that. Daily updates. Doesn't need not as many people there. And then hearing from other practitioners, a lot of people there. And then so thank you very much. Okay, so let me just go back to this. And then immune group class. So for the people that are interested in that, that will be billed to insurance. What do you want to hear about most? So basically, it's the main question is, do you want to hear more about the nerdy, dorky stuff that is like some of the stuff I post on Facebook, like you know, how the immune system works, physiology of the immune system. We can talk about in depth about natural killer cells. We can talk about T cells and B cells and how lifestyle affects these cells and, you know, that kind of thing. Or do you want to talk about more about practical tips, like what they all could be practical. So this question, you know, how to support your immune system, how to basically, what can you do to support your immune system, or do you want both, you know? So we want to, again, make this super helpful to you and super useful to you. We haven't done a group class in this format before virtually. And I think, you know, I'm proud to say that I think that not many practices are offering this right now. So I hope this is a benefit and a value to you. So more physiology of the immune system and how things work and tinker with your system, or how to support your system in a way that, like, what should I do about this right now, or both. Are we allowed to go a little over on this? So both, most people both, and definitely more practical than physiology, but most people both, so thank you. Jen, are we allowed to go over, or is it gonna cut off at one?
You can continue.
Continue, okay, I'm gonna continue because I wanna really hear from people too. And we have an open forum now, and please call in and, you know, do the raising hand thing. Really would love to hear from everyone about, you know, what people are doing to support their own mental health during this crisis. And like I said, at least, you know, from our perspective, this is a collective trauma, right? We always talk about physical health, but there's mental, emotional, and spiritual health crisis that's happening right now, where we're all kind of going through this collective trauma, some more than others. So I mean to say that, you know, some people are actually dying from this. You know, 60,000 people are dying from this. People have lost their loved ones, are in the hospitals, or in the ICU. So then other people have lost their jobs, furloughed, you know, so there's just a lot of, and then other people, their schedules are disrupted and they're working from home and taking care of kids. And, you know, then we don't know, you know, what's going on with, you know, sort of as a country, like, you know, what are we doing? That whole uncertainty about how long this is going to last. So all that is trauma. So we'd love to hear from you guys about this, and just kind of talking about this.
Andy, do you
I think most people are still on. Yes, Liz.
She'd love a little bit of clarification about the immune system and cytokine storm relationship.
Yes. Well, basically, as you were saying, Liz, it's a double-edged sword. So you want to have inflammation in the beginning so that the T cells can get activated and kill off viruses. But then you also want it to be not too much, because by the time the virus, or, you know, by the time organisms get into the system, you want to reduce inflammation so that your body doesn't start to attack itself and cause inflammation of the blood vessels in the lungs, and basically cause lung problems. So I think there's a double-edged sword where you want to have enough inflammation in the beginning, but you don't want to have too much if it's there.
Question, would anybody be interested in a breathwork class? So not just like, you know, not just like breathing in and out, but like a breathwork that works to build up our immunity, but also to take us into a little bit of an expanded state so that we can de-stress on a deeper level. Oh, good.
Yes, definitely.
Okay, good. Okay, I'll start thinking about how to organize that.
Great. That's great. Thank you, Liz.
Okay, great.
Better link to YouTube. Okay. Also, class on myofascial release. Yes. We can talk to Carrie and see if that's possible. That would be great. Or do you want to do the group meditation, or are you thinking a variety of people? Or
I'm happy to do that. I'd love to.
Yeah.
Do that.
No, you're really great at that.
I've been doing it with some friends, and it's really
nice. Yeah, we all need some hugs, Linda. I love that comment. Thank you. Yeah, we're all gonna give a virtual hug here. Just as much as we can. Just you know, and I think it's important that, you know, hopefully when things kind of get less crazy about that. Definitely touch your loved ones, when things are more safe, because we need touch, we humans need touch, so that's so important.
Andy, I was thinking, I just want to mention something. There was one person who was talking about feeling really unmotivated these days, and it was asking if anybody else is feeling that way. Well, I definitely can tell you I have been feeling that way.
Mm-hmm.
And I think what I'm learning for myself is just I have to create structure, because every day, at least for me, seems like it's the same day. And so what I'm doing now is it's taken me a few weeks to get into it, because I'm not necessarily a very structured person to begin with, but I'm setting up. I'm taking a shower every day now.
Mm-hmm.
I have a sauna, so I actually am like getting in my sauna. But if I don't do that, I'm taking a walk. I have
Mm-hmm.
a scheduled call with someone who, when I touch base with that person, it really grounds me. So
Mm-hmm.
getting and sitting down for lunch, eating it at a table.
Yeah, yeah.
Dinner. So I think the structure can really help start to kind of like make us feel, more in control, really, but in a healthy way.
Yeah.
Um,
And it's those little things, like one thing I used to do was which I still do, depending on is that, yeah, like when I get home, this sounds like a really little thing, but I'll go home, and even if I know my wife has checked the mail, I'll still like take that time to walk outside for a minute and just look at the trees, and then check the mail and just open the box. So I literally walk from the garage to the box and then back, and it's like this ritual that tells me that, hey, I'm doing this. I'm actually giving myself, I'm kind of stealing a minute of of just like being outside and breathing and just kind of enjoying the nature, a little bit. So these are things. Yeah, I mean, I think these rituals of sitting down to eat, of doing your mind body type of practices, are huge. I know there's some people that did want to chat, or did want to, yeah, gratitude journals is huge. We are working on the supplement thing. I think someone was saying, we do have the shipping. I'll ask Christine about that in terms of how to properly ship that, but I want to thank you for that too. Anyone want to raise their hand and talk about how they're dealing with mental health? It could be a patient, could be a practitioner here. I'd love to just hear from you, hear some other voices here. Thank you for raising your hand. So Stephanie, let's see. Do I say chat? Is that what happens? No. How do we call on her?
So you should be able
Can you
to
guys hear me?
Yep.
Oh, there.
Hi there.
Okay.
Yeah,
Hi.
thank you.
Thank you, Stephanie.
Yeah, so I've actually been making time to take a bath almost every night, and just finding that time to turn down the lights, turn off the cell phone and the laptop, and shut the door if you're able to, and just really take some Epsom salt baths and relax. And I do that for about 20 minutes, and it's really helped with my sleep. I know, Dr. Wong, we talked about me having issues with sleep recently, and I've started doing that this past week, and it's improved, being able to go to bed, without any issues and staying asleep for most nights.
That's a great ritual. That's a great calming ritual, taking a bath at the beginning of the night. Do you add a little, you said Epsom salt, do you add anything else to it, or?
Epsom salt, and I might do some oils. I just
Mhm.
don't have any on hand anymore, but I would do that, and baking soda sometimes.
Yeah, baking soda. Yeah, that's great. One of our friends from India that came shadowing us one time. She adds lavender oil to the Epsom salt, and that's a nice calming thing. Well, thank you for sharing that, Stephanie. That's a great technique, and I'm glad you're sleeping better too. And then Evelyn, I think, was next. Thank you. Let's see. How do we?
Hi, I'm unmuted, right?
Yeah, I think Jen is doing that. Thank you, Jen. Thank you.
Oh, my computer tells me just to press my space
And then
bar.
Mustafa is next after Evelyn. So yes. Hey, Evelyn.
I have been very worried about the food supplies and very frustrated by trying to stay home and not go to the grocery store and whatever. And so I really pushed the envelope on my vegetable gardens and started planting things very early and just by circumstances, I happen to have bought a lot of my vegetable seeds early this year because I waited too long last year and got shut out. So I had a lot of seeds on hand, whereas many people are struggling now to get them. And I'm looking at my romaine that's about 9 inches tall and starting to form heads because I put it out in the garden 6 weeks ago. And spending time out in the garden watching everything grow has really been my therapy.
Yeah, that's great. You know, nature is the best medicine, you know, at times, right? So that's, yeah. When is the best time to get seeds, you know, in general, for the spring?
Well, starting late winter, actually. Mom's has very good quality seeds at very good prices, better than a lot of the other agricultural places. And there are some places I'm now discovering online. But basically, they laid in a stock, I think it was in January. It was way before any of this happened. And as I said, I'm interested in heirloom things. I love the purple tomatoes like Cherokee purples and the black crims and black prince and all these others. They're so tasty and they're much healthier for you because they have all the extra antioxidants in them. So each week I'd go to the grocery store and I'd say, oh, look, they have this and they have this. And in fact, sometimes I wound up buying the same packet twice, like a month apart. But I collected a whole bunch of seeds. And so the best time to buy them is as soon as you see them, but just remember where you put them away so you can find them when it's time to start germinating them and planting them.
Thank you, Evelyn. That's great. I'm going to go to Mom's and look for some seeds.
And also, you know, getting in the dirt's really good for our biome. Do you remember that article Andy sent?
Yeah, connecting to the earth thing. We should have a yeah. That's I mean, earthing is amazing. It's really just being barefoot on the earth and catching the soil and getting your hands dirty in the soil. I mean, this is what we all need, and we're all basically deficient in the earthing, you know, because we're all indoors and we're all wearing rubber-soled shoes. So I almost think we should have a Zoom on that at some point and just like get in the dirt.
That would be a great idea. I want to join.
Yeah, the computer might get a little messy, but we can try that. Thank you, Evelyn. So Mustafa, I think, is next. Mustafa, is that, yeah. Jen, can you unmute him, or can I do that?
Hello, can you hear me?
Hey, Amber.
Hi, it's actually
Hey.
me. Mustafa and I've been doing a little bit of gardening, like the other lady was talking about.
Mm-hmm.
We've also taken to walking outside for at least 45 minutes to an hour.
Nice.
I used to walk in the mall, but because of my allergies, but now I put on my mask and double mask myself and try to walk outside for at least 45 minutes every day to stress down a little bit.
Nice. Is it helping the allergies too? Is it filtering the pollen and all that?
If I wear a double mask, yes, but if I wear a single one, and these are just paper masks, if I wear a single one, not so much. If I wear a single one, I usually have to come back and take a little bit of an antihistamine because I'm so allergic to the pollen and the mold and, you know, all the other things outside.
Yeah.
Manage
That's
with
great.
the double mask.
Yeah, walking and getting outside and, you know, breathing the fresh air, you know, I think all these things are really good for our physical and mental health. So yeah, thank you for sharing. It forced you to get out of the mall, I guess.
And on the cooking front, I've been trying to, as we said, there are very few vegetables that are available all the time. So if I get a cabbage, I'll make 3 different things out of it, you know?
Mm-hmm.
So to stretch something and that in itself is you know, something you have to really think through so that you're not getting bored with the same thing eaten every day, you know?
Right, to vary it up. Variety is a spice of life, yes.
So that's another thing that you have to think of.
Well, good to hear from you and Mustafa there. Thank you so much, Amber. And yep, I think keeping things kind of interesting there. I know we have Liz Reese as well as Dana and Bill there. So Thank you so much. So Liz, yeah, great to see you on the call. Thanks for joining us.
Hi, yeah, I'm glad to be here. Thanks for doing this. So one thing that's been really helpful for me is when I first wake up in the morning and I get out of bed, and as soon as I put my feet on the floor, I start to dance. Just a little dance, just standing there right next to my bed, and I am concentrating on moving my body and just being thankful that I'm here and it's another day. And it feels really good. I'm moving and got a little tune going on in my head, and it starts my day off on on the right foot.
I was gonna ask you if you had the music. What music do you have playing in your head on the Liz
Oh
Weiss
my goodness.
radio there?
It's really different every day. This morning it was
Yeah.
Oh Susanna.
Oh, Susanna, that's a great song. That's a great song.
The other day it was Highway to Hell. So I don't know. It depends on the day.
Depends on the day. That's funny. That's great. That's a great. I'm gonna start doing that. Usually for me, it's like that my son comes in the room and starts to like try to wrestle me or something. So that's a type of dance, I guess.
Absolutely.
That's another question. Would people want to do a group movement class? There's like group unwinding myofascial, but there even could be like group ecstatic dance or something like that.
Yeah, with the whirling dervishes, and like putting some music on. We're all kind of shaking our body. Dr. James Gordon at Center for Mind Body Medicine always plays the Three Little Birds by Bob Marley, and then you just shake and do all this stuff, and you can close your eyes, if you want to, so you're not looking at other people or they're not looking at you. But it can all be kind of a group thing and really fun. I think it's a great idea. We could all dance. Maybe not right in the morning, but maybe later in the day, middle of the day or something.
Friday night,
Friday night, yes, with some. So thank you, Liz. Yeah. And let's see. I think Dana and Bill. So Dana is next, I believe.
So I think we'll have to go to Bill because
Bill.
Dana,
okay.
Setting needs to be fixed.
Okay. So Bill, hey Bill, great to hear from you.
Yeah, can you hear me?
Yes, very well.
It's been very helpful, these insights and experiences of all the attendees, and what I'm doing. Remember, I'm a senior citizen. Just to keep healthy and sane, is to follow a structured routine and exercising and taking a bath with Epsom salt, as was recommended, and and also just keep my mind active and think positively about this pandemic, because all things pass. We have to remember that.
Yeah, that's very wise. That's very true.
And I know this is a rough period for everybody, but we have to really look spiritually as well as and physically in terms of what's happening, the economic disruption and the mental distress we need to deal with, of course. But if we go in, like has been suggested, with guided meditations and quiet periods, it's really going to give us peace of mind, and that's what we need in these chaotic times. Yeah. So I don't have much more to say, but keep up the good work, Andrew, with these webinars. I think they're really useful.
Thank you, Bill. Thank you for those words of wisdom as well. I mean, that's and it will pass, at some point, and we're going to get through this together. So thank you so much.
I think we have Dana on now.
Dana, okay. Hey, Dana.
Hi, Andy. Can you hear me?
Yeah.
And you can see me. Hi.
Hey, how's it going?
I just want to thank you very much for putting this together as well, and I'm very grateful for this time together as a group. I really don't think I have anything much to add except just really kind of an integration of perspectives of what I've been hearing that I'd like to share, and that is, when we look at energy, if you go to the subatomic level and you look at our bodies, we are just energy. Mm-hmm. We are made up of physical energy. We are made up of electrical energy. We're made up of chemical energy, as is the earth. And
Yeah.
so when we were talking about the elements, you know, it makes logical sense a lot. The other thing I just wanted to reiterate was that, yes, we are in this change. And as we go through change, if you remember back when you went through puberty and your body was changing, if you remember when you went from being an infant to a mobile child, for those of you that maybe have given birth, you know, and you've gone through that change as well, right now we are going through a huge change. It's an external change in the aspect of our culture, our community, our structures are all changing, and we're responding to that, as well as if, say, our exposure to corona and our body now literally, if for those that get exposed to it are having to change. So all of those elements and the energy in our body is being put through this huge transition. And the last thing I would mention is just, it's really about, as you go through transition, any transition you've gone through in your life, you go through those times of where things are shifting and the balance is off. And it's an and. You're going to have suffering. You're going to have peace. You're going to have day. You're going to have night. And I'm going to reiterate that thing about nature. If you just look to nature, it is such a great teacher, in addition to the greatest healer, in my opinion, is nature.
Yeah, so that's awesome.
It's just one of those things. So I just encourage everybody, you know, to practice grace and mercy with yourself, to find yourself. What are those things that help you shift through all of this and move with it? It's in between the structure and the unstructured, but it's also you're going through that transition of what do you control and what do you have to let go of? What's going to be that new norm? What's going to come out of this as we get through it? Because it will never be what it was. But one of the reminders I like to tell people is if you go back through those major changes in your life and you think about, you know, we always talk about hindsight, and you can sit back and go, well, what were the blessings and what did I come out of it? I came out of it with probably some growth. Sometimes we have to step back a little bit and experience things again to see how far we've come forward. So anyhow, I share those pieces because that's really came up strongly as I was listening to everyone, and it's something that I am continuing. Like you said, Liz, yes, I'm going through that too. I'm shifting. What are those things that used to work for me that no longer work for me? And it's a little frustrating sometimes because I get triggered because I want those things to work again, and they don't. And then I've got to do some internal work. So on my website, I did put a recorded Reiki session that I offer to everyone. That's something you can do at any point, any time right now. And I just, if you have the time.
Absolutely. So it's linked to the presentation, I believe, right? Somewhere.
It may not be, but you've got my website, aurorabalance.net, and I have the link now on there. It's just a recorded Reiki session.
Okay, I'll check that out. Thank you so much. We can check that out there. Thank you, Dana, so much for those words of wisdom, and certainly a lot of the changes now. I think we got two Jackies coming up. Jackie Appel first.
Hi, I'm here.
Hey, Jackie.
How are you?
Good. How are you?
I just wanted to say that this being able to connect with people even through the teleconference thing is so helpful. I just really have enjoyed these sessions because I'm learning at the same time as being able to, you know, see possible solutions to all of our problems, and, you know, like, or health problems, and understanding the health problems. I think in some ways this conference call thing is even better because we're not so busy. We all have to focus on the same thing, but we're all forced into the same situation where we're focusing on the same thing. But also I think that gardening has really helped me through my whole illness. I've been like, every year I just go out and work in the yard. It's been a great way to get rid of frustrations and also create happiness and peacefulness, and look at flowers and create. We have a fish pond, and
Oh, nice.
It's a lot of work. It has a little Japanese garden with a Buddha.
You have the koi fish in there, or?
We used to have goldfish, but they kept getting eaten by animals. So we kept a net over it for many years, but it was so much trouble. We just kind of, after they died, we just kind of didn't replenish them. But now I take care of the pond, and I found a way to clean it out using the pond motor, and I bought some like piping at Home Depot so I can pump out all the bad water and then refill it. And every year I go through this now. It's a huge job, and it's like a lot of work, but I just kind of get a lot out of just making the pond look good again. And the animals in our yard love it. They come and drink, all the squirrels and the chipmunks and the birds, they come and drink out of the pond. And so now I'm taking care of all the animals. I put out food for them. And it's just gotten where it just really helps me to divert from the news and all the bad stuff. It just being in the yard, and it's just like a huge break from all the mental trauma.
Yeah, it's a break from it. And it reminds me of something I read one time on Facebook, is that we're not really connected to nature. We are nature, so if we think about it that way, we're really, being nature, and, being outside and quote unquote connecting to other animals and plants and the sunlight and the earth and the fresh air, that's what we're meant to do, so it sounds like a lot of people, as a common thread, either is connecting through, whether it's like a water element through the bath, or through, sunlight and fresh air from walking outside, getting out of the malls, and getting into the outside, or planting different, heirloom tomatoes, or, whether it's for you, working on the fish pond, or, on the pond that and then your animals that are your neighborhood animals are, benefiting from that. All these things are connecting to nature, and kind of reaffirming that we are nature. We are part of this beautiful, tapestry that is both, have life and death in it, right? That's sort of but certainly from a perspective of what can we do right now, I think that's very powerful. So thank you for sharing that, Jackie.
Thank you. Yeah, thanks.
Thank you. I got Jackie, second Jackie here. I think I know who that is, but hey, Jackie. I think, let's see, you can unmute.
Hey, can you hear me now?
Hey, Jackie. Hey, good. How are you?
Good. Hey, Dr. Wong.
Hey,
Liz is here too.
Hey, Liz. How are you guys? Yeah.
We wanted to tell you when we start our day with a real fun thing. After our first cup of coffee is we go down in the basement and play ping pong.
Oh, that's amazing. That's the best morning.
We resurrected the table from under the stuff we were just stacking on it. And we have two goals. We don't keep score. The goal is to just keep it in volley. And the other one is to keep from losing the balls behind the furnace or the washing machine.
I love that. It's a cooperative game, not a competitive game. That's the best way to do it.
If it ricochets off the wall, then you still try to hit it back to the other side of the table. And it just is a lot of laughter.
Yeah. So you got the laughter, the oxytocin in. Something I posted on Facebook is I think it's like 1 minute of laughter resets your immune system and boosts your immune system for 24 hours. So you're literally supercharging your immune system by playing ping pong and laughing together, and that's amazing.
Oh, that's wonderful.
Yeah, that's great.
Liz wants to tell you something.
And before I come downstairs, to be beaten by Jackie in ping pong every morning.
No, we don't keep score.
We don't keep score.
The outcome is not predetermined, right?
Right, but I pick up more balls than she does. But anyway.
Yeah.
I do a little gratitude journal. First, I am so grateful to be alive and to have my health and to have you all, your whole practice, Dr. Wong, just keeps me going, and I'm thrilled about that. So I write that, I start that. I guess it's mental dancing. I like the person who put their feet on the floor and dances. Well, this is mental dancing. And then I write an intention for a day, what I will complete, 1 or 2 things. That's one. And 3 days a week, we do the exercises, the drills that HESA has recommended. And then every 2 weeks, we have a virtual meeting with HESA, and which he puts us through our paces and then changes what we do. So that has all been very helpful, and we've been doing what Jen has told us, and we're now going
all good. Yeah.
For nutrition.
Are you going to try out for the rescheduled Olympics whenever that comes about? It sounds like that you guys would be good candidates for that. They do have table tennis. That is a sport in the Olympics, Summer Olympics, right?
Well, you would not call what we do a
We can create a new sport for that. Yes.
But it starts the day with exercise and the brain and hand coordination and laughter. It's wonderful.
The laughter is huge, yeah. And laughter, yeah, we should all laugh every day. We can even have there's actually this laughter yoga. I've never tried it myself, but it would be cool to do some sort of, I don't know if Christine, you've done that, but there's like these sessions where you can like do yoga and laugh at the same time, or, there's different things like that. But yeah, Jack and Liz, yeah, that's great. Thank you for sharing that.
Okay, I also saw something on the internet where a family or a couple people were playing some kind of cup ping pong. They had ping pong balls and they were simply trying to get them in, but what happened was the same thing. They ended up laughing.
Isn't that, I think there was alcohol involved, because I think that's a college game, beer pong, right? Where you like drink beer and try to put the ping pong in the cups. I was never good at that game. Did not really play that really. Yeah, so yeah, ping pong. Yeah, I grew up with a ping pong table. We had a table, and I enjoyed beating my sister, but I think I was too competitive, and then I think later on I realized that cooperation is probably the name of the game more than competition. And laughing and having good times. It's really fun. And then later, as I got older, my cousin, who's like 12 years younger than me, he was all competitive, and he had a fun time beating me. So then I kind of got on that. It was really fun. So thank you so much for bringing that up. And doing what you enjoy, doing what you love doing, whether it's ping pong, whether it's dancing, whether it's yoga, doing things that really stoke your passions and stoke your soul and feed your soul, because that's what we all need right now. We all need soul food. And ways to nourish ourselves. So thank you for that. Linda, thank you for waiting on the call. Let's get to Linda here. Thank you, Linda. Great to see you too.
Hey, good to see you again.
Good to see you.
I wanted to bring up a couple things. One, to lower how upset people are feeling, turn off the news. Those numbers are going up. They're going to keep going up for a little while.
That's a great point.
And it makes me think, when I lived in the Middle East and there was a lot of violence, a lot of bombings, and the psychologist would tell us, watch one time, but if you keep watching it over and over again, you're getting re-traumatized. And I think that there's a lot to that. I find yesterday I decided I'm not going to turn on the news. I'm not going to look at the ticker on CNN. And it really made a difference. So I don't know, just throwing that out there.
I think it's great advice. I don't watch TV myself at all. I just use the internet at times, and I think the thing about reading the news is you can always like go to different news sites, but like Happy News or whatever. But I think it's really important to choose the radio channel that we want to listen to, right? So if you listen to like angry music, you'd be angry. If you listen to negative news all the time, we need to know what's going on in the world. We can't be like in the soil with our heads in the soil and not. But I think there's a limit, like Linda said, in terms of how do we kind of balance out our need for the information with not getting re-traumatized every time with that, by listening to it too much. So I totally agree with that. It's a matter of the dose might be different for each person, but I do feel like, the more people, I think there's actually studies on that, the more people watch TV and like watch the same things, because the news is designed, even pre-COVID, right? The news is designed to be negative, because the body, the brain is what is it? It's Velcro for, like, our brains are what's called the default mode network. I don't want to get too like dorky in this, but the brain is designed to be Teflon for the positive and Velcro for the negative, which means we're inclined based on survival mechanisms that we're all created to have, to keep the negative aspects of news or information or bits of information to store in our brain so that we can survive. So just knowing that the newscasters know that. And so I'm not trying to promote distrust in the media or anything, but it's more like, how do they sell newspapers, how they sell TV shows? You have to put some negative news on there, because then people are going to remember it. They're going to want more, because that's how we're kind of designed to do. So we have to be a little mindful of that. And I think choose to change the channel or turn off the channel, sometimes, and do some of these other things that are more health promoting than always watching the TV.
Yeah, that's for sure. I like the Teflon Velcro analogy. That works really well. Another thing, before all this happened, this started months ago. I'd been feeling like I just wanted to take a year off from life, just stop, just get off the merry-go-round. And now that I have the opportunity to do that, and I don't have to have all the daily stresses, I'm working from home. I'm a teacher, so I'm working from home. So that's not a problem. I don't have to, I get to work and, be taking care of kids in the same way every day. But when I was thinking about that, it didn't occur to me, and not until this meeting. So this was very helpful to me. I didn't know where I would end up on the other end of that year if I took a year off.
Hmm.
And the things that a lot of people have said today have helped me to feel like it's okay that I suddenly realized this, and I'm actually in the middle of trying to figure that out. Where do I want to end up? What is that going to be? So I'm grateful that some people brought up different points that I hate to use the word triggered, but triggered that in feeling in me.
Yeah, stimulate your brain, and there's life is all about uncertainty. In fact, the only certainty of life is uncertainty in some ways. But then there are some things that we can be certain of, which is that we can decide to be intentional about the uncertainty in a way. So I think that's what you're doing. So that's very inspiring. Thank you, Linda, for that, and thank you everyone for the feedback, the participation, the calling in, the voting. Thank you for continuing to trust in us and to support this and to basically create this with us as a group here. Please join what Jen has kind of started here, which is the CIH tribe on Facebook. If you're on Facebook, if you're not on Facebook, that's fine. If you are, please join that, and we can establish community there as well. Based on the feedback, we'll be continuing to do these town halls. We have the next one, which is going to be in next Thursday. So thank you for your vote of support there. And share this with your friends. Share this with your loved ones. This can be something that can be open to more people that may not know about us. They may want to just check us out, even if they don't want to be patients. The point is just to be of service to the community. So I think anyone that you want to be on here that you feel would be benefiting from this, in a way that will be helpful to them, please share that with them too. So we will meet again on next Thursday, May 7th here at 12. And great to see you all, and have a great rest of your day. Thank you, guys.